Isabel, 2016, and I really remember the moment because I was based in Asia Pacific at the time, and there was this mail in my inbox about a proposal how we can make bigger impact in cancer care, and the way to do it is by focusing on local communities and bring together the public and the private sector and civil society. I liked the idea, but part of me was like, oh, this is never going to happen.
You're like a new other project. Yeah. I think back then it was when we reached out to Roche, which was one of the first we reached out, was an idea only, was a white page. And the idea was that all of these global initiatives were focusing from a top-down approach. And we were not seeing actually impact happening in the ground. So we wanted to turn things around and actually put the focus at the local level. And then we came with this idea of working with cities, because cities reflect the system in a smaller scale.
I mean, what I liked in the beginning, right from the beginning is you had this element of, first of all, it has to be local, and that matched our experience. You know, we have tried as a company a lot of things on a national level to improve cancer care, and turns out if you want to have sustainable impact, it has to be really deeply grounded in the infrastructure and in the people on the ground.
One of the things that I remember, and actually I always wanted to ask you, because back then, the concept of strengthening health systems from a local perspective, working with city, got a lot of pushback from the community. I remember we got some critics, and I remember even hearing somebody telling us we were in La La Land and that cancer should be addressed at national level. But despite a lot of critics and a lot of resistance, Roche thought this was a good idea. Why? Why you thought we were in the right track?
So I think it's a mixed feeling. First of all, you can be very convincing. Second thing is that we just have seen that it doesn't work if you start national, because it does not reach then really the people on the ground, and we knew it. And we also looked at the data and then the evidence. And we knew we need a different concept, and there's a super urgent need that you just bring public, private, civil society around the table. And honestly, you were the only one at the time who had this idea that looked like a potential solution.
But there's three things I think that make it successful. One, a joint vision. Both Roche and SICAN are committed to improve lives of people in low middle income country, and that is above any challenge that we should face. The second one is that we are complementary to each other. Roche's responsibility is to bring the best innovation to the ground, best drugs, best diagnostic to improve the lives of people. Our role is to ensure that the systems are ready so that those innovations get utilization for the right people, the right time. And of course, together we need to make sure that that's affordable and reach the most vulnerable populations. And the last one, the third one for me is the people. The people that are leading the partnership, they face a lot of challenges on conflicts constantly. They cannot pick up each conflict and make that the big battle, because the big battle is improving the lives of people with cancer.
You said this is about sustainable. And this is where we actually met, because like as Roche, I'm interested in a sustainable business. And that was sort of like where it started for the partnership. What's going to be the next wave then?
Where we're next is how we take those outputs into outcomes. And that requires other type of skills, other type of resources, other type of expertise. And now we need to start seeing, okay, how this intervention is going to reduce time from diagnostic to treatment, how this intervention is going to reduce a percentage of treatment abandonments, how this intervention is going to guarantee access to specific diagnostics that are quite sophisticated, or how we take those cities from very, very basic diagnostic to the next level. And we have examples already, but now we have to do it in a way that it brings also a bit of research and implementation science behind, so that what we've achieved can be actually shared.
I really think that anyone who thinks about doing a public-private partnership could hugely benefit from having a look at the SICAN-Roche partnership collaboration framework, because we used all the learnings. We used not only the things that did go well, we also learned from the things that did go wrong during this time and put it into this framework so we can really help others to have like just who want to go on the same journey than we did, but just like accelerate the time till you can really come and thrive and flourish, making an impact on the ground.
We're not going to solve it alone. I mean, and again, there is what brings us together, but also there is the academic space. There's also the government. There's also the health providers. And I think it's also how in our partnership, on any partnership, it should not be closed. We have to open up to others.